everybody. Today I'll talk about the respiratory system. It is responsible for respiration. That's the main function. That means breathing. You inhale the air from the atmosphere and expel the air to the atmosphere. That means you inspire the air into your lung from the outside of your body, and then you expel the air from the lung to the atmosphere outside of the body. Now, when you inhale the air, you take the oxygen. That's the purpose of inhaling the air or inspiration, because your body uses that oxygen for its metabolism. Okay, and then the body produces carbon dioxide, and that should be expelled. So when we expire the air or expel the air out from the lung to the atmosphere, we expel the carbon dioxide. So that's the respiration or breathing, right? Now, your respiratory system has other important functions. We'll talk about that. Just know that the respiratory system works closely with the cardiovascular system, because after you take the oxygen into the lung, from the lung, your blood, which is a part of your cardiovascular system, takes the oxygen from the lung and gives the oxygen to the body, to the tissue. And that's why the respiratory system and cardiovascular system, they work together to accomplish the function, right? So in this lecture, first we'll see the parts of the respiratory system and the important functions. Then the entire respiratory system is divided into two zones, conductive and respiratory zones. We'll see what are those two parts of the respiratory system. Then we'll talk about the respiratory epithelium. Respiratory epithelium is the inner lining of the respiratory tract, and the respiratory epithelium is a part of your immune system, protection. And in the lymphatic system and immunity, you have learned that the first line of defense is given by the skin and the mucous membrane or epithelial membrane of the respiratory tract and GI tract. So we will talk about the respiratory epithelium, which is the innermost layer or lining of the respiratory tract. For example, this is your trachea, right? So this is the wall of the trachea, and this is the innermost mucous membrane or epithelial membrane, and it prevents the antigens from entering into the body. Okay. Then we will talk about the anatomy of your nose. That means the structure of the nose, pharynx, larynx, trachea, and lung. Then we will talk about the mechanisms of breathing or respiration. What's the mechanism of inspiration and expiration? Respiration has two phases: inspiration or inhalation, that I mentioned already, and expiration or exhalation, right? This is to take the oxygen with the air to the lung from the outside, and this is expelling the carbon dioxide with the air from the lung to the atmosphere. Then we will talk about the respiratory volumes and capacity. We measure the volumes and capacities to test the lung function. So basically these measurements are for the lung function tests. Lung function, to see if your lung is healthy. Okay, so first we'll see the parts of the respiratory system. You know that the uppermost part is the nose. So nose is the beginning, right? Now the part you can see from outside is the external nose. That's the only a part of the whole or entire nose you can see from outside. However, if you see inside the nose, you have a cavity that is called the, okay, so nasal cavity. After the nasal cavity, next part is the pharynx. Pharynx is a muscular tube. So it is a muscular tube-like structure. It has three parts. We'll talk about that later. Then next part is the larynx. Larynx is also known as voice box. Vocal cords or vocal folds are located inside the larynx to produce the sound. Okay, so larynx is mainly a cartilaginous tube. So pharynx is a muscular, but larynx is a cartilaginous tube. Trachea is the next part. Trachea composed of cartilage and muscle. So it is a combination of both cartilaginous rings and muscle. So you see, pharynx is a muscular, larynx is a cartilaginous, and trachea is formed by both. Okay, the trachea, the lower end of trachea, if you see, this is the trachea. The lower end divides into two divisions or branches for your two lungs. One goes to the right lung and another goes to the left lung. Makes sense? And these branches are called the primary or main or principal bronchi. Bronchi is plural and bronchus is singular. So you have primary or principal or main bronchi, right and left, these two. Makes sense? And they enter into the respective lungs. And then right one enters into the right lung, left one enters into the left lung. Then inside the lung, they divide into secondary bronchi, also called lobar bronchi, because in your lung, if you see, there are lobes. In right lung, you have three lobes, right? So this is 1, 2, 3. And for three lobes, three secondary or lobar bronchi are formed. In your left lung, you have two lobes. So you have two lobar bronchi. Make sense? And then, like the branch of a tree, as they go more inside the lung, they divide again and again. So it's like a branch of a tree. Big branches give the small branches. Make sense? So secondary bronchi give the tertiary bronchi, smaller branches, and tertiary bronchi give the terminal bronchi, the respiratory bronchi, alveolar duct and alveoli. Now gas exchange takes place through the wall of these last three structures, okay, through the wall of the respiratory bronchi, that's why called respiratory, and alveolar duct and alveoli. Most of the gas exchange takes place through the wall of the alveoli, but a small amount through the wall of the respiratory bronchi and alveolar duct. So from the nasal cavity to the terminal bronchi, all these structures or parts are to transport the gas, to take the gas towards the lung. Makes sense? But no exchange of gas takes place through the wall of these structures. That's why these structures together is called the conductive or conduction zone. Makes sense? Only to take the air inwards, and then through the wall of these last three structures, gas exchange takes place. That's why these belong to gas exchange or respiratory zone. Makes sense? So if I just see the last three parts, this is the respiratory bronchial, and then the alveolar ducts. These are the alveolar ducts, and these are alveoli. So look like the grapes, a bunch of grapes. These are air balls, alveoli. Okay, so respiratory bronchial, alveolar duct, and these are alveoli, also called alveoli, and this is a sac, alveolar sac. So inside the sac you have many alveoli. This is another alveolar sac. This is another alveolar sac. Make sense? Okay. So two zones I have already explained. So now you see how the primary or main bronchi, they enter into the right and left lungs and divide inside the lung. And if we start from the beginning, this is the nasal cavity, this part is the pharynx, this part, and this is the larynx, this part, and this is the trachea here. Okay, and then trachea divides into two bronchi. Okay, right and left, primary or main bronchi. Now you see these are the tracheal cartilages, right? And these are C-shaped cartilages. So from the front it will look like a circle, but if you see the back, it's like open. Okay, and here you have the muscle called trachealis muscle. So this is the cartilage and this is the muscle, okay, in the back. So these are the cartilages, and shape of the cartilages are C-shaped cartilage, and the last one you see here, this is the last piece of tracheal cartilage. This one is not C-shaped, this is rather like V-shaped cartilage, and this V-shaped last piece of cartilage is called carina. So here it divides into two, primary or main or principal bronchi. Okay. Okay, now you remember in my first slide I showed you that inside the respiratory tract you have the respiratory mucosa. If I make a cross section, this is for example your trachea. Okay, if I make a cross section and see inside, this is the cross section, right? This is the lumen, this is the wall, and this is the lumen, and this is the respiratory mucosa, innermost lining. So when you inhale the air passes through this lumen, right? And your inhaled air might have microorganisms, right? We don't see, but all the time we are inhaling the microorganisms or other antigens, dust. So the respiratory mucosa is preventing them from entering into the body. Okay, so it is a barrier, it's a protection. And in the respiratory mucosa you have some glands, serous and mucous glands and goblet cells, and they secrete some chemicals. Okay, and those chemicals also stop the microorganisms from passing through the layer, as well as the secretion has some chemicals that can destroy the microorganisms. Okay, so the secretions are mucus secretion is sticky and thick, slippery secretion, you know that, slippery, sticky secretion, and that makes a thin layer in the mucosa, so that layer trap the microorganisms or dust or other antigens because it is sticky and thick, and that is one way the respiratory membrane protects your body. Another is the Serra secretion, another type of secretion, that's the Serra secretion. And mucus and serous secreting cells or glands, same thing, they secrete the seromucus secretion. Serous secretion is more watery and it has some chemicals that can destroy the microorganism, defensive lysozyme. And mucus, as I told you, is a thick, sticky secretion that makes a layer and also traps the antigens. Also, if you see the inner lining, there are hair-like, soft hair-like structures. Let me draw here again. So, you have soft hair-like structures. These are called cilia, and cilia move together to push the dirty mucus posteriorly. So by the movement of the cilia, the mucus, that secretion that traps the microorganisms and other antigens or dust, would be cleared. We need to clear that mucus, dirty mucus, all the time, right? So the cilia work like a broom. Okay, and also you have macrophages, you know, the phagocytes, phagocytic cells. So macrophages would engulf the antigens and destroy them. So that's how the respiratory mucosa protects your, that's the defensive function of the respiratory mucosa. Now there is a clinical condition that is called the cystic fibrosis. It's a serious form of disease that happens, it's a genetical disorder and happens more commonly among the Caucasians of Northern European descent. And what happens in cystic fibrosis, you know, the secretion that takes place from the mucous membrane is very thick and very sticky, like glue, you know, thick sticky glue. So that secretion cannot be cleared by the cilia. So the secretion would block the small respiratory tracts. So the secretion is very thick and sticky like glue. So that will accumulate inside the respiratory tract and would block the passage of gas, right? So gas will not be able to enter into the lung, enter into the alveoli of the lung. So that is a serious condition, you know that, and the person will suffer from first the lung will not be able to work, and then your cardiovascular system and heart will be affected especially. So production of abnormally thick sticky mucus in the conductive zone or division of the respiratory tract, and mucus restricts air flow and possibly block smaller passageway, and also in that mucus the pathogens, that means the microorganisms, bacteria or other virus, other microorganisms can colonize, can stay and multiply there, and that would cause another problem, infection, right? And usually in cystic fibrosis the patient don't survive too long, and death results from the heart failure associated with the chronic bacterial infection in the lung. Here you see the respiratory membrane, okay, or mucous membrane. So you remember there are mucus secreting cells, also Serra cells are there, and this is the secretion that sticky, slippery secretion. This is called the mucus, right? So mucus is secreted from the mucus secreting cells. These cells secrete mucus, and that mucus forms a layer, and that is a barrier, right? And you see the cilia here. These are cilia. You can see here in larger picture. So these are cilia, and they are soft hair-like structures to clear the mucus. So push the mucus posteriorly, so it will go to your stomach and will be destroyed. The mucus containing the antigens will be destroyed. Okay, now we'll see the epithelial lining at different parts of the respiratory tract. First, if you see inside the nasal cavity, the lining is the pseudo-stratified. It is not mentioned here, pseudo-stratified columnar epithelium. And you see pseudo-stratified has cilia, right? Then this is the pharynx, and in the pharynx you have two types of lining. Pharynx has three parts. This whole part is the pharynx. Now uppermost part, you see this part has same lining, pseudo-stratified columnar, from the nasal cavity to the upper part of the pharynx. You have same lining. However, the middle part here, this part, you see the food enters into this middle part through the oral cavity, and that's why the chance of friction is high here in the wall. So remember, where the chance of friction is high, the lining is stratified squamous, many layers of squamous flat cells, not pseudo-stratified ciliated. Okay, so the air passes through this middle portion, which is the oropharynx, as well as the food passes, right? So that's why it is not pseudo-stratified but stratified squamous. Also the last part, both air and food pass, right? So it is stratified squamous. So the second part and third part of your pharynx is lined by stratified squamous, but the upper part is lined by pseudo-stratified columnar, because in the upper part only air contains. However, in the middle part and lower part, you have both air and the food pass through it. Now there is larynx. The larynx and trachea both have pseudo-stratified, because only air. So remember, the parts where only air passes is pseudo-stratified columnar, and it has cilia, cilia. Where food also passes, that part is stratified squamous. Make sense? Now if you go inside the lung, the bronchioles have different type of epithelial lining. Bronchioles are lined by cuboidal epithelium. You see cubical shaped cells and a single layer, so cuboidal epithelium. And in the wall of the alveoli, if you see the wall of the alveoli, you have another type of lining, that is simple squamous, a thin layer of flat cell. You see the flat cell. So why? Because the simple squamous makes the layer very thin, so the air can easily go from the alveoli to the blood and also from the blood to the alveoli. So gas exchange is the function here in the wall of the alveoli. Okay, gas exchange. So now you can just think that gas exchange can easily take place through the wall or layer which is very thin. Makes sense? That's why it is simple squamous, a thin layer of flat cells. So you see in your respiratory tract you have different types of epithelial lining in different parts. Again, in the upper respiratory tract you have pseudostratified columnar where the air passes, and where the food also passes, that is stratified squamous. And inside the lung, the bronchiole, you have the cuboidal epithelium, and in the alveoli you have the simple squamous for gas exchange, oxygen from the blood, from the alveoli to the blood, and carbon dioxide from the blood to the alveoli. Okay, now we'll see the first organ of the respiratory system, which is the nose. Okay, nose is the primary passageway for air entering the respiratory system. We all know that, and through the external nares or nostril, the air enters into the nasal cavity, right? And if you press the upper part of your external nose, you can feel the hard bony part, right? That is the bridge of the nose, which is formed by two nasal bones joined together to form the bridge of the nose. And external nares or nostril is the opening, and then the cartilages. If you press the lower part of your external nose with your fingers, you can feel the soft cartilaginous part, right? So upper part is hard bony formed by the nasal bones, and lower part is cartilaginous that you can easily move, that has elastic cartilages, few pieces of elastic cartilages, and that's why you can easily move it. So here you see the upper part is formed by two bones, two nasal bones, and this is the bridge of the nose, and the lower part has nasal cartilages. These are elastic cartilages, so you can easily, these are flexible, right? You can move, but it will come back to its actual shape. Okay, and then paranasal sinuses. Around the nasal cavity you have a number of sinuses. Sinuses are the spaces inside the bones. So in the bones around your nasal cavity you have some cavities. Those are the sinuses, and the sinuses are, paranasal sinuses are maxillary. Two maxillary bones have two maxillary sinuses, and these are the largest sinuses of your body. Then you have frontal sinuses inside the frontal bone, ethmoidal air cells or sinuses, many inside the ethmoid bone, and sphenoidal air sinuses. Okay, so these are the sinuses around the nasal cavity called the paranasal sinuses. And sinuses improves the sound that you produce. Okay, and also sinuses secrete mucus. So mucus secreted by the sinuses helps keep the surface of the nasal cavity moist and clean. So all the time you know that inner surface of your nasal cavity is moist, right? And that is very helpful. Now we will see the nasal cavity, and inside the nasal cavity you have extensive network of veins, and since in the inner surface of your nasal cavity you have many veins, and veins contain blood, right? And you know that the blood is warmer, and since a lot of blood flows in the inner surface of your nasal cavity, inner surface is always slightly warmer than your body. So that is very helpful when you inhale the air, especially in winter time. In the winter time, when you inhale the air outside, the air is cold, right? So that cold air passes through the nasal cavity and gets contact or touch with the surface, which is warm. So that air would get warmer before it enters into the lung. If cold air directly enters into your lung, that can cause pneumonia or other lung related problems, right? So very, very helpful. Okay, and the surface is not only warm but also, you know, that inner surface of the nasal cavity is moist and sticky. So when the dry air is inhaled, you inhale dry air, that would get moist when it passes through the nasal cavity, okay, because the surface is wet and moist. So moistening the air is another important function. So warming the air as well as moistening the air before it enters into the lung. Also, inside the nasal cavity, you have some structures. Those are called the concha, nasal concha, and those are actually some extended shelf-like structures, and when the air passes through the nasal cavity, because of those concha, there are three: superior, middle, inferior in each side. So you have three pairs, and because of those structures, the entering air would stay there and circulate inside the nasal cavity for longer time. So it will get, you know, mixed or with the moist surface and the warm surface of the nasal cavity. That is called the turbulence of the air, is helped by the concha. So to make sure that the air gets enough time to get moist and warm. Okay. Also, inside the nasal cavity, you have the smell and taste receptors. You know, when you get infection or cold in your nose, then the taste of food changes, right? Also, you don't smell. So, of course, we have the smell or olfactory receptors inside the nasal cavity, as well as we have some taste receptors. Taste receptors are mainly in your tongue, but some taste receptors are also present in the nasal cavity, wall of the nasal cavity or epithelium of the nose. And production of sound, we know that nose plays some important roles in the sound that you produce or the speech you produce, and you can easily test if you hold your nose and speak, the sound changes. Also, when you get cold, the nose gets closed, so the sound you produce, the sound changes. The speech, the sound of speech changes. So nose also plays important role in the production of sound. Inside the nasal cavity, you have a nasal septum. That's the partition. It divides the nasal cavity into right and left halves or parts. And nasal septum has bony part and cartilaginous part. Okay, so bony and cartilaginous part. Bony part is formed by two bones, perpendicular plate of ethmoid and vomer. Ethmoid comes from above, perpendicular plate of ethmoid like this, and vomer from below. So this is vomer, this is the perpendicular plate of ethmoid, and they join to form the bony part, which is in the back of the nasal septum. In the front part you have the cartilage, okay, and which is the hyaline cartilage, not elastic. Okay, so the septum has hyaline, but in the external nose you have pieces of elastic cartilages that I showed you before right here. These are elastic cartilages. Okay, but inside the nose you have the partition or septum, which is hyaline. Okay, concha, as I mentioned, there are three in each side, superior, middle and inferior, and when the air, you inhale the air, that air would whirl or circulate for some time before it enters into the lung, and that is the air turbulence that is helped by this concha. So they work like the turbulence, and that would allow the air to get enough time to get moist and warm before it enters into the lung. The roof of the nasal cavity is formed by these two bones, ethmoid and sphenoid, and the floor is the palate, and palate has two parts. Hard palate is the bony part and soft palate is the skeletal muscle part. Okay, so let's see, this is a coronal section through the nasal cavity. Now you see through the front part of your head actually. So you see here, this is the nasal cavity here, and this is the septum, right, the partition here. So upper part is the bony part formed by these two bones I mentioned already, and then you see concha. These are nasal concha for air turbulence, and this is the floor of the nasal cavity, right? And you see this is the oral cavity. So oral cavity and nasal cavity, they are separated by the palate, and you can actually put your finger inside your mouth and move up to touch the palate, or you can use your tongue, move your tongue up, and you can touch the palate with the tip of your tongue. That's the palate. Now palate separates the nasal cavity and the oral cavity, right? So it is the floor of the nasal cavity but the roof of the oral cavity. Makes sense? And it is formed by it has two parts. Hard palate is the bony part formed by two bones, maxilla and palate, palatine bone. So hard palate is formed by maxilla and palatine bone. Palatine bone, of course, would form the palate, but part of it, and maxilla is the anterior 2/3 part. So most part is by the maxilla and posterior 1/3 by the palatine bone. That's the hard palate. And soft palate is the soft part of the palate, which is formed by the skeletal muscle. And the skeletal muscle, this is the soft palate, this is the hard palate. Hard palate has two bones. It has two bones. If I divide into three parts, anterior 2/3 is formed by the maxilla, and this is the anterior 2/3. So anterior 2/3 is formed by the maxilla, and posterior 1/3 bony part is formed by palatine, and this is the soft palate. It is a skeletal muscle structure and covered by thick mucosa. So skeletal muscle covered by thick mucosa. So that's the soft palate. Okay, now after the nasal cavity you have the muscular tube, that's the pharynx, and pharynx has three parts. Uppermost nasopharynx only for the air, and oropharynx and laryngopharynx, these two parts are for both the air and the food, both air and food. Okay, So from the nasopharynx, air enters into the oropharynx, and from the oral cavity or mouth, food enters into the oropharynx. So it is the middle portion of your pharynx, and the last portion is the laryngopharynx, and this is also for both air and food. Makes sense? Now, since this one is only for the air, it is pseudostratified, as I mentioned before. The epithelial lining is pseudostratified columnar, right, has cilia. Since these two are both for air and food, food will cause friction, so stratified squamous, but the chance of friction is high. Okay, now in the nasopharynx, couple of structures you will see. One is the opening of the auditory tube that connects the nasopharynx to the middle ear to brings the pressure equilibrium of the pressure. If the pressure inside the ear increases, some air will escape, will go to the nose, to the nasopharynx. Okay, and also the pharyngeal tonsil, which is known as adenoid, you already know, is attached to the posterior surface of the nasopharynx. Okay, and oropharynx is the middle portion. So from the oral cavity, the food first enters here, and then the food will pass through the laryngopharynx. And below the laryngopharynx, you have the larynx, right? So from the laryngopharynx, food enters into the larynx, and the air enters into the larynx, which is anteriorly, and food enters into the esophagus. So food enters into the esophagus. Makes sense? And this is the larynx for the air. So you see the laryngopharynx is here, and from the laryngopharynx, food enters into the esophagus, which is posteriorly, and air enters into the larynx, which is anteriorly. So they get separated, and when you swallow the food, food should not get into the larynx, right? That's why you have a cap here, a lid. It's a cartilaginous structure, elastic cartilage, that is called the epiglottis. So epiglottis would close the inlet of the larynx, so the food will not be able to enter into the larynx, but it will enter into the esophagus. You know, if food enters into the larynx, it will go to the lung, to the respiratory system, right? So that's not safe. Okay, epiglottis. So epiglottis moves up and down. When you swallow the food, it closes, moves down to close the laryngeal inlet. When you breathe, the epiglottis opens the larynx. Make sense? So it is a cartilaginous elastic cartilage structure. Okay, here you see, this is the first part of your pharynx, this is the second part of your pharynx, and this is the third part of the pharynx. Okay, so nasopharynx, oropharynx, laryngopharynx, and then the air enters into the larynx, food enters into the esophagus. Make sense? And this is the cap of the laryngeal inlet. This is the laryngeal opening or inlet, and this is the epiglottis that moves up and down, that I mentioned. Now if you see the nasopharynx, this is the opening of the auditory tube. So auditory tube, one end is here, the other end is in the middle ear. So the air is connected to the pharynx by this tube. So if the pressure increases in one side, some air will move out. And also this is the pharyngeal tonsil you see here, attached to the posterior surface of the Nasopharynx. Makes sense? Larynx, as I mentioned, is known as the voice box. Also, it is a cartilaginous structure. It has both paired and unpaired cartilages. There are three small paired cartilages, that means those are two each type, is two in number, and three large unpaired, that means one each of each type. So three large unpaired cartilages and three small paired cartilages. Unpaired cartilages are thyroid, cricoid, and epiglottis. So these are three single or unpaired cartilages. Okay. All the cartilages are hyaline except the epiglottis, that is elastic, I mentioned before. Unpaired cartilages are larger. Thyroid is the largest one, also known as Adam's apple. And you know that Adam's apple is more prominent in male, right? After adolescence, the cartilage gets larger because it is sensitive to testosterone, the male sex hormone. Okay, so it gets larger in presence of testosterone. And cricoid is the second larger one. Okay, and paired cartilages are arytenoid, corniculate, and cuneiform. Those are smaller and two in each type. So you see here, this is the laryngeal prominence or Adam's apple formed by thyroid cartilage. This is the epiglottis, and this is the cricoid. These are large paired, unpaired cartilages, and paired cartilages are smaller. You can see here arytenoid, corniculate, and cuneiform. Okay. Now, if you see the structure of the larynx, you will also see ligaments or membranes. Okay, so the large ligament is here, that is called the cricohyoid membrane. This one actually it is a flat membrane like ligament, that's why it is called a membrane, and between the thyroid and hyoid bone, thyroid cartilage and hyoid bone, that's why it is called thyrohyoid membrane. Makes sense? And this one is between cricoid and thyroid cartilages, that's why it is called cricothyroid ligament. So this is cricothyroid ligament and this is thyrohyoid membrane. And larynx is called the voice box because it has the vocal cords or ligaments. So this is one vocal cord, and above the vocal cord you have vestibular cord or ligament, and vocal cords are responsible for the production of the sound. Here you see paired small laryngeal cartilages, cuneiform, corniculate, arytenoid. Glottis is the opening between the two vocal folds, and the size of that opening or space between the vocal folds changes when you make sound. So here you see, if you look from the top, this is the glottis, the opening between the vocal folds. Okay, so these white structures are the vocal folds or vocal cords, and the space between them is the glottis. And here you see the glottis is closed completely, here the glottis is open. So when you produce sound, the vocal folds or cords move. Sometimes they come close to each other, sometimes open or go apart. So that's how the sound is produced. And vocal folds are supported by the vestibular folds or vestibular cords. So these are the vestibular folds. These are the vocal folds. Okay. Trachea. Trachea is also known as windpipe. Okay. and it is formed by many C-shaped tracheal cartilages that I mentioned. How many? 15 to 20 C-shaped cartilages. Okay, and the last one is V-shaped, that is called the carina. Okay, and the trachea, the lower end of trachea, divides into two primary or main bronchi, right and left. Now, if you make a cross section of the trachea and see, it has three layers in the wall. Of course, mucosa is the innermost, you know that, mucosal lining or epithelium, and then you have the middle layer, and the middle layer is the layer where you have the cartilages. So tracheal cartilages are located in the middle layer. So this is the innermost mucosa, this is the middle layer, and outermost layer is called the adventitia. Okay, so those are three layers in the wall. Okay, how the air flows from the trachea to the alveoli. We already talked about these branches, right? Okay, bronchioles are the branches of the respiratory tract inside the lung. Go downwards, that means more and more branches are formed, diameter changes, get smaller, right? The wall of your bronchioles has smooth muscle. So the smooth muscle can contract or relax. Factor that causes the bronchodilation or relaxes the bronchial smooth muscle is sympathetic stimulation, bronchodilation. So the tube will get opened more, will relax the muscle. And parasympathetic stimulation would cause bronchoconstriction. That means the muscle would contract and cause the narrowing of the bronchioles. That's the bronchoconstriction. Okay, there are some drugs or medicines that can also cause the bronchoconstriction or bronchodilator. You know, the puffs, the asthmatic patients, they take the inhaler or puff that has the chemical that would cause the relaxation of the bronchial smooth muscle to cause the bronchodilation. So more air will be able to pass through the tubes or bronchioles. Okay. Now the lungs, you have two lungs, right and left, and they are not exactly same, because the right lung, if you see and compare the right lung with the left one, the right lung is broader, that means wider but slightly shorter in height than the left. Left one is narrower and longer. So narrow but height is slightly more. And in the right lung you have three lobes: superior lobe, middle lobe, inferior lobe, separated by the fissures. These are the cuts or deep grooves called the fissures. That makes sense? So this is the transverse fissure going this way, and this is the oblique fissure going this way. So transverse and oblique. So superior lobe, middle lobe, inferior lobe. And you see right lung is wider but shorter this way. Left lung is narrower but longer, and it has only one fissure or deep groove. So it has two lobes, upper or superior lobe and lower inferior lobe. Makes sense? And the bottom of the lung is called the base, and it rests on the diaphragm. So diaphragm is attached to the base. Okay, and when the diaphragm moves down, it pulls the bottom of the lung downwards, and the pointed upper end is called the apex. So apex is pointed, kind of pointed around upper end. So those are the differences between the right and left lung. Another thing is, in the left lung you have a notch, U-shaped area, that is called the cardiac notch. Why? Because to give some room, you know that your heart is mainly located in the left side. Most part of it is in the left side. So in the left lung you have the U-shaped area to accommodate the heart, that is called the cardiac notch. So the heart is here. Okay, makes sense? So those are the differences between the right and left lung. In the medial surface of your lung, if you see, you have an area, indentation, and through that area the primary or main bronchi and also blood vessels, nerves, lymphatics, those structures pass. So this area is called the hilum of the lung. Primary or principal or main bronchus enters into the lung, respective lung, and also blood should get in and get out. So you have the blood vessels, arteries, veins, and also nerves and lymphatics. Pleura is the covering of the lung. So the lung, if this is your lung, it has the covering. Now the covering has two layers. One is attached to the surface of the lung, so it is directly attached, right, to the surface, and then what happens, you see here, it gets folded like this and form the outer layer. So this is the outer layer like this. So this is the inner layer. So inner and outer, two layers of the pleura. So the outer layer is called the parietal and inner layer is called the visceral. So visceral is directly attached to the surface of the lung, and the space between these two is called the pleural space, okay, or pleural cavity. And in this space the fluid, it is partially filled with fluid, and that fluid is the pleural fluid, and this fluid acts as a lubricant. So when the lung gets smaller and bigger, right, expands and recoil, the fluid between these two layers would prevent the friction between these two layers. Otherwise they will rub each other and that will cause pain, and that happens in pleuritis. So pleuritis is the inflammation of the covering of the lung. That means itis is the inflammation of the pleura. Okay. Okay, now if you see the alveolus, so this is the alveolus, and you have capillary bed on each alveolus. So this is the capillary. So now you see each alveolus has a capillary bed on its surface. Makes sense? And when you inhale the air gets into the alveolus, right, and it has oxygen and the blood inside the capillary. So here you have the blood. So blood goes to the lung to get the oxygen from the inhaled air, right? So O2 will go from the alveolus to the blood here, and carbon dioxide will move always to the opposite direction, that means from the blood to the alveolus. Remember, oxygen and carbon dioxide always move to opposite direction. So we know why blood goes to the lung, to get the oxygen. So blood will get the oxygen from the alveolus and carbon dioxide will go from the blood to the alveolus, and that is the gas exchange now inside the lung. Now this membrane through which the gas exchange takes place, that is the respiratory membrane. Makes sense? So now if you look carefully, this membrane is formed by two layers. One is the capillary wall, right, and another is the alveolar wall. This is the alveolar wall, okay, the black one. So the capillary wall and the alveolar wall together, they are attached to each other, and you have the air here and blood here, right? So this is inside the capillary, this is inside the alveolus. So this is the respiratory membrane. So it is formed by the alveolar wall and the capillary wall. Now both the alveolar wall and capillary wall both have two layers. Alveolar wall has alveolar epithelium and a basement membrane. So alveolar epithelium is this one, and the basement membrane is this one. Okay, so this is the basement membrane, this is the alveolar epithelium. Make sense? So this is the alveolar wall. Now the capillary wall also has two layers in it, the basement membrane and the capillary endothelium. So this is the capillary endothelium and this is the basement membrane. So you see both the alveolar wall and the capillary wall have basement membrane and they are attached to each other. So we can say fused basement membrane, this part. Two basement membranes coming from each wall. So fused basement membrane and capillary endothelium. So capillary endothelium. So we can say it has three layers. If you see from the alveolar side, alveolar epithelium, fused basement membrane and the capillary endothelium. Okay, and through these layers the gas must be able to pass through for gas exchange. So here you see the same thing. Fused basement membrane is this one in between, and this is the alveolar epithelium, this is the capillary endothelium. Okay, so from the alveolus, O2 goes to the blood, and from the blood CO2 goes to the alveolus. You see here, these are the alveoli, and on the surface you have the capillary bed. So each alveolus has a capillary bed. Okay, now in the wall of the alveolus, if you see the alveolus in the wall, you'll see three types of cells. Most of the cells are simply squamous. That means what? Single layer of flat cells, right? Squamous type cells, you already know that. So this is simply squamous flat cells. Okay, and then you also have other two types of cells. What are those? You have some macrophages, phagocytic cells, and also surfactant secreting cells or type 2 cells. Okay, so three types of cells. Squamous cells are type 1 and the surfactant secreting cells are type 2. Secrete surfactant. Remember that surfactant secreting cells are very important because they secrete a fluid that is called the surfactant, and that actually lines the inner surface of the alveolus and helps to keep the alveolus open, prevents collapse of the alveolus. So surfactant is a very important fluid, and that is secreted from the surfactant secreting cells or type 2 cells, and surfactant keeps the alveolus open. Okay, so macrophages engulf the antigens. So here you can see this is an alveolus, and in the wall you have simply squamous, you have the surfactant secreting cells, these are surfactant secreting cells, and you have the macrophages, these are the macrophages. Okay, and these are simply squamous cells or type 1 cells. So most of the cells are what? Simply squamous type 1 cells. You have some surfactant secreting cells, you see secrete surfactant, and some macrophages. The mechanism of breathing, how the breathing takes place. To understand the breathing, you have to understand three pressures. Inside the lung, you have a pressure that is called intrapulmonary or intraalveolar, same thing, pressure. Okay, which is not fixed. It changes during breathing. Okay, changes between 759 to 761 millimeter of mercury. So a little bit goes up and down. Okay, and outside of your lung you have the pressure in the atmosphere outside of the body that is fixed, that is called atmospheric pressure, which is always fixed, right? At the sea level, it is 760 millimeter of mercury. And now there is another pressure. You remember between the parietal and visceral layers of the pleura, you have the space, and in that space, the pressure is called intrapleural. Makes sense? Pleural pressure, and this pressure is always less than intrapulmonary pressure or intraalveolar pressure, and that pressure is 756 millimeter of mercury. Okay, so now you see when a signal goes from the brain to the diaphragm, you remember the base of your lungs sits or rests on the diaphragm that I mentioned before. So when a signal goes from the brain to the diaphragm via the phrenic nerve, the diaphragm contracts, and when the diaphragm contracts, the diaphragm moves which way? Downwards. Remember that. So when the diaphragm moves downwards, the bottom of the lung is attached to the diaphragm, right? So it will pull the bottom of the lung downwards. So what will happen? The lung will get expanded this way, vertically. Makes sense? Both lungs will expand vertically. And when the lung expands, the pressure inside the lung, air pressure, will go down. Makes sense, right? And at the same time, what happens? The signal goes to the respiratory muscles, intercostal, between the ribs. So intercostal muscles are attached to the ribs. So what will happen? The ribs will move forward and slightly upward. You see, forward and slightly upward. So the ribs will move forward and slightly upwards. So that will expand the lung this way. Will pull the lung forward. So will expand horizontally, anterior-posteriorly. Makes sense? So when the lungs will get expanded both vertically and anterior-posteriorly because of the movement of the diaphragm and the ribs, then the space or volume inside the lung will increase. Makes sense? Expand, and that will drop the pressure inside the lung to what? 759. Okay, so when the pressure inside the lung will be 759, what is the outside pressure? 760, right? So this is 1 millimeter above than this one. So air, remember, this is a rule, always moves from high pressure to low pressure. So when inside the lung the pressure will drop 1 millimeter below the atmospheric, the air will get into the lung from the outside. Makes sense? Because of that 1 millimeter pressure difference. And that is the inhalation or inspiration by the contraction of the diaphragm and the intercostal muscles. And now after inspiration, then the diaphragm will relax. So when diaphragm relaxes, it will go back to its actual position. It will move up, and the intercostal muscles will relax, so the ribs will move backwards, and the lung itself is highly elastic, so the lung will recoil itself because you expanded it by pressure, right? So when the pressure is gone, then the lung will recoil, like the elastic thing you use in your clothes. You expand by pressure, but when the pressure is gone, it will go back to its actual size. So that's the recoiling. So the lung will squeeze, so the pressure inside will go up, right? If we squeeze something, the pressure inside, the air pressure goes up, and that will go up to 761. So when inside is 761, outside is always fixed 760, you have 1 millimeter more here, so that will move the air out. That is the expiration. Okay, so recoiling of the lung due to the relaxation of the diaphragm and the intercostal muscles, and that will increase the interpulmonary or interalveolar pressure to 761, and that will push the air out. So that's the expiration. So the mechanism of inspiration and expiration. And who sends the signal to the diaphragm and the intercostal muscles? The brain. Which part of the brain? The brain stem. Inside the brain stem, inside the pons and medulla oblongata, you have the respiratory centers. We'll talk about that later. Okay. Thanks everybody.